another edition of the Data Analytics webinar series looking at the role of data analytics on various industries. And today we're going to be looking at the role of data analytics in the health sector, the role of data analytics in the health sector, the health industry. And we have three amazing people, three amazing data analysts who will be doing justice to this conversation. First, we have Mr. Isaac. Mr. Isaac, can you say hi to us, please?
Good evening, everyone.
Okay, and then we have Miss Yoma. Yoma, please say hi to us.
Good evening, everyone.
And then we have Miss Havila. Havila, say hi to us as well.
Good evening, everyone.
Amazing. So let's start with you, Isaac. Over to you. Can you talk to us about briefly, very briefly, what data analytics is?
All right. Good evening, everyone. Thank you for having me. My name is Chinanu Ezengbe Isaac.
Sorry, Havila, you can
Data
go ahead and
analyst.
mute your mic for now. And the same thing with Yoma. Thank you. Yeah, go ahead, Isaac, now.
Can I go on, sir?
Go ahead, sir. Go ahead, please.
All right. My name is Chinanu Ezengbe Isaac. Yes. I'm a data analyst. I'm so happy to be here talking about this. What data analytics is and the role of data analytics in the health sector. It is very important for us to understand the importance and how powerful data analytics has grown to be in the health sector. So before we proceed, we have to understand what data analysis is all about. So what is data analytics? So since we are talking about the health sector, I want to paint a picture for us. So from that picture, I can use to explain what data analytics is all about. So just assume that, let's say you own a pharmacy, right? Let's say you own a pharmacy where you sell drugs. So every day you sit down and then you record the medicine that are selling very fast. Also, you record the ones that are not selling at all, the ones that are just selling maybe once in a while. You record all these things. This From these things you have recorded at the end of the month, this information you've recorded down in your book will not tell you what you have to restock. That is the medicine, the drug you have to buy more. You understand? So that simple act of recording, and then you collect, you analyze your shop, and then you see that, oh, this medicine is not selling, this drug is not selling fast, and this one is selling fast. So I'm going to be buying more of these drugs. That simple act is just data analysis. So you are collecting data, you are reviewing it, and you're then making decision, which is the decision you have made is which has led you to choose to, okay, I'm going to be restocking this drug the more. So simply put, so what is data analysis? From this picture I've painted, you can see that data analysis is simply the process of collecting data. As the process of collecting, organizing, and then also interpreting data to discover useful insights, that help people or organization to make better decision. So just as I can put it in a very simple way, the way I can put it, breaking it down, data analysis is simply the process of looking at information and then making sense of it and using it to make better decision. So there are there are um, there are four types of data analytics. Yes, data analytics is divided, or it's categorized into four types. We have what is known as prescriptive data. Sorry, let's start with descriptive. We have what is known as descriptive data analytics. So this descriptive analytics, it talks about what happened. Descriptive analysis focuses on what happened. For example, since we are like talking about the health sector now, let's say hospital or in a clinic, the descriptive data analysis focuses on what happened. For example, how many patients visited the hospital last week or last month, right? How many patients visited the hospital last month? So it talks about what happened. That is, it talks about, it describes what happened. We also have the diagnostics analytics. So now this one focuses on why did it happen. So how many patients visited the hospital last month, and why did hospital visit spike in that month, or why did hospital visit reduce in that month? You understand? So that is diagnostic analytics. It talks about why did that thing that happened. So we also have the predictive. So we have the predictive analytics, which focuses on what might happen. This one is like a focus. It focuses what will likely happen because of this thing that has been like this. So what would happen next? So, like for example, now in this picture I'm painting about the hospital of a thing. So, like now, how many patients are likely to come in the next month, right? From the data you have gathered, what happened, how many patients visited last month, and then why did it happen? So now from there you cannot predict how many patients now will visit the hospital maybe in the next week, in the next month. Are we together? So now, and then the last type of data analytics is the prescriptive. The prescriptive. Now, just talk about what should we do. Now, this thing has happened this way, and then okay, we know what happened. Okay, we know what also might happen. Okay, well, from the information I've gathered, this is the thing that will likely happen. So now, what should we do about it? So, for example, now if the prescription says that okay, by the let's say by the end of the month June, at the beginning of July, um, patients visit to the hospital will increase because we're in the rainy season, and then there's likelihood of there being malaria. You understand? So, from the information that I've gathered, what now should we do? You understand? So these are the four types of data analytics. So yes, then the next slide, sir.
Thank you so much, Isaac. Thank you. That's an amazing section right there. And we're just going to move on straight up, and then if we're going to have another speaker, maybe we're going to bring up Yoma to be able to talk to us a brief about the health industry. Just give us a brief about the health industry, and yeah, please go ahead, Yoma.
Okay. Good evening, everyone. I'm going to take you guys in the health industry itself. Because before we talk about how analytics fits in, we need to understand the world it operates in. Now, um, in health, it's very critical and it's unlike any other sector in the planet. For instance, in finance, a bad decision might cost you your money, but in healthcare, a bad decision can cost someone their life. That's the way this industry carries every single day, and that's why data matters so much here. Now, I divided this part into three. We're going to talk about the global scale, the subsectors, and maybe a little bit of challenges as health workers. Now, the global scale, the healthcare industry is currently over 10 trillion US dollars annually, and also it is the fastest and largest growing industries in the world. Every single day, billion people interact with health workers. You're meeting, you're going to the hospital, you're dropping your data and every single thing. Now, healthcare also generates data than most any other industry. A single large hospital generates approximately 50 terabytes of data per year. Now, if you multiply that amongst hundreds and thousands of hospitals, you begin to understand why managing and analyzing health data is such a critical and complex task. Now, the next set I'm going to talk about is the major subsectors. On our slide, we have about five. We have the hospitals and clinics, the pharmacies, the health insurance, the medical research, and the government agencies. All these are subsectors and they have their own different data. For the hospitals, you could go to the hospital, they check your weight, your height, and everything. At that point, they are collecting data. At the pharmacy, they're taking down the type of drug you bought and how well it worked for you. For the insurance, this one covers every hospital visit you go. I think here in Nigeria we have what we call HMO, and it's popularly for big companies where families of about 4 5 will be under. Then they go to the hospital. They don't pay a dime for any hospital visitation or any purchase of meds. Now we also go to the challenges. I know I'll come back later to talk about the challenges in data cleaning, but I'll just touch just a little here. Now, the real challenges facing the global health system: inequality of access, rising chronic disease, aging population, and pandemic preparedness. Now, for the pandemic preparedness, we could remember that in 2020, COVID-19 shocked the whole world, and this exposed how fragile our global health systems were. And we had slow sharing of data between countries, inconsistent case definitions. This caused a whole lot. Now, for the aging population, in Japan right now, they have more older people than younger people, and which is a crisis right now. And by 2050, over 2 billion people will be age 60 or older, and these age people need more health care, more medication, more monitoring. We also have, like I said earlier, inequality of access. Most people are not really, they lack access to essential health services. Some parts of the rural areas where they still do by paper recording, whereas somewhere in Switzerland they are using AI diagnosis tools, but somewhere else in the rural area we are still doing paper recording. We also have rising chronic disease. Yes, the medical research has brought up a new way of curing cancer, but not everybody will still have the access to get cured of the cancer. And other non-communicable diseases like hypertension and diabetes, we still have a little bit of issue. Thank you.
Thank you so much. Thank you. Amazing thoughts right there. Thank you for telling us a whole lot about the health industry. So now we're going to move into talk about the what is data and types of data. We're going to move into talk about what is data and then types of data. And guys, I will want to welcome Miss Havila to come talk to us about that. Miss Havila, over to you if you can hear me, ma'am.
Okay, good evening, everyone. Good evening, Mr. Stewart. It's a privilege to be here. Okay, so what is data? Think of data as a jigsaw puzzle, right? Data is facts, data is unprocessed information, right? That is arranged for human suitability, and transmission. So data in its raw form is actually pretty very raw. You can't really work with just data. So an arranged form of data is known as information, right? And there are two types of data we have generally, right? Quantitative and qualitative. The quantitative data talks about data in its numerical form, in its numerical value, right? The amount of people in a city and the rest, that's quantitative. But qualitative has to do with um, the quality of the data. When in qualitative data, we aren't talking about um, the amount of data points, right? We're talking about the quality of the data. And in the healthcare industry, we have about four to six types of data, right? So talking about patient data, that can also be described as demographic and identity data. So in patient data, it's more or less like their bio data. We're collecting their name, their age, their gender. Um, we're collecting we're collecting unique national identifiers, right? It prevents medical identity fraud. So patient data helps to prevent medical identity fraud. The next we have is clinical data. And clinical data has to do with lab results, test results, x-rays, and the rest. So in clinical data, it's more or less like specific to what the patient has when a test is run on the patient and the rest. That's a form of data gotten from the clinical part of things. We also have the administrative data. Now, administrative data is more or less like the operational data, right? So we're talking about billings, we're talking about admission rates, we're talking about discharge status. Is it outpatient or an inpatient? We're talking about consultation lengths, how many consultations in a month. We're talking about doctor to patient ratios. So each patient has like how many doctors assigned to them. That's an administrative type of data. Okay, we also have the financial and insurance data. That's also called the claims data. So this is what the billing systems use, right? For claims, for reimbursement, cost of treatment. HMOs also use this kinds of data, right? Because it helps them to know what treatment is paid for and what treatment the patient needs to pay for and the hospital needs to pay for. So if there's a subcharge or a subsidized amount of billing given to the patient, this is what tells us that. Okay, so we also have data in the public health. Now, this is where we talk about outbreaks, pandemics, mortality rates, natality rates, basically talking about statistics. So, if there's an outbreak or an epidemic or a pandemic, right, this data helps us to identify what gender has this, which gender has this, how many people in a particular region has this disease affected. This is what public health data talks about. Now, we also have data collected by wearables and devices. Technology has gotten so beautifully fantastic that we now have data in our smartwatches. So data could be recorded in our smartwatches by amounts of steps you've taken, our vitals, right? Heart rate, pulse rate, and the rest. All these are kinds of data. So when these kinds of data are retrieved and collected, right? Data analytics in the healthcare industry helps us to ascertain what is the next best line of action to take. So, if for instance, in our clinical data, we receive a data saying, oh, this person has a high blood pressure, low blood sugar, right? It helps us or it helps the healthcare professionals to actually analyze this data to know the next best line of action to take in order to save lives, right? And as one of my speakers rightly said, data in the healthcare industry actually save lives. So it's important for us to work from the known to actually get the next best line of action to take. Thank you, Mrs. Scott. Over to you.
Thank you. Thank you. Wonderful insights right there. Thank you. Thank you. So, please, if you're watching and you have questions, please can do well to drop your questions in the chat box so we can be able to uh, answer your questions. So I think I need to move on now. Let me ask. Let me quickly ask. Sorry. Let me quickly ask Mr. Isaac if you would like to speak to us on what's it called now? Let's say the key impacts, of
All right.
yeah.
All right. Okay. Okay. Thank you so much, Ms. Avila, for such a wonderful presentation. So thank you for Mr. Stewart for how the webinar is going thus far. So I want to also like talk about the that is the key impact of data analysis in the healthcare sector. That is the role of data analytics in the healthcare sector. So data analysis, as I've already established from the beginning of this webinar, is not just a behind the scene tool. Data analysis is actively changing how patients are treated, how hospitals are run, and how diseases are fought. You know, it's not only it's not just any test skill. It is actively participating in transforming the healthcare sector. So we are going to like touch um, just uh, uh, a few role data analytics is playing in the healthcare sector. So number one, um, data analytics is helping to improve um, patients' outcomes. Yes, it's helping to what? Improve patients' outcome. As already said from the beginning of this webinar, we say that data analytics is talks about collecting data. You collect data, you clean, you analyze, and then you use the data that you have collected to make informed decisions. When this data analytics they collect this data, they analyze patients' record and treatment history, um, so that healthcare providers can identify which treatment best work for specific conditions. For, for example, analytics can reveal that some patients with diabetes um, who also receive early nutritional counseling have significantly fewer what's it called hospital readmission. So by analyzing past records, um, past histories of patients, doctors are able to know the best drug and the best way to administer medicine or drugs or any form of administration to patients. So one of the roles of data analytics in the health sector is that data analysis is helping the health sector to improve patients' outcomes. So another very important role of data analytics in the health sector is data analytics is helping to predict disease outbreaks, just like Havila, no, not Havila, just like Yoma pointed out, doing um, how COVID-19 hit us, and that is 2020, 6 years ago. So this kind of outcomes can be easily predicted by data analytics by studying past records, how diseases come in, what causes all these diseases, and then presenting this information. This form of outcome, even though this disease later break out, then by the time it will break out, measures must have been taken to fight this disease from the predictions that are being made by data analysts in the health sector. So data analysis analytics is also helping to reduce medical errors. You know, one of the biggest issues we are fighting in this our economy, like exactly especially in the healthcare sector, is the number of errors that are being committed in our hospitals. Understand? So data analytics helps to fight these errors. it brings systems it predicts systems to correct errors. For example, you know, past records can actually past records can actually give us a lot of insights about how the future will be. So data analytics, when they study past records, they can say, okay, this is where and error came from in the last time. This is where this error came from. This is where this error came from. So by blocking the places where these errors are coming from, it helps to fight medical errors. Also, so it also helps to um to accelerate medical research. It helps to what accelerate medical research. Pharmaceutical companies use data analytics to analyze the results from clinical trials faster, which it helps to analyze clinical results from trials faster, which helps to identify um, patients' response to best, how patients respond to some drugs, and how and which drug is best used for uh, each patient based on the kind of illness that patient is going through. So it helps us to pro- to what's it called, accelerate medical report. And also data analytics in the healthcare sector is also help to control um, healthcare costs. The healthcare sector is a sector that is really expensive. And some patients, you have seen countless records of patients, some patients losing their life due to the cost that is associated with them being treated. So data analytics help to control the healthcare cost by predicting the best medications each patients can take, and then like the best medication with a very low cost. With a very low cost, each patient can take. It helps to control healthcare costs. So this is where I'm going to end the few roles of data analytics in the health sector. I know that my colleagues will have one or two things to drop concerning these roles of data analytics in the healthcare sector. Thank you.
All right. Thank you so much. Thank you. Thank you, Mr. Isaac. Thank you. So, thank you for outlining these roles of a data analytics or data analytics in the health sector. You talked about improving patient outcomes, predicting disease outbreaks, very, very important. Um, Reducing medical errors, because, of course, if we have data analytics properly done in health sector, in the entire value chain of the health sector, then we're going to be able to eventually get results, optimizing hospital operations. But however, sir, it is true that there are challenges when it comes to this whole data analytics thing in the health sector. And I know that two of those areas where we encounter those challenges will be during data collection and data cleaning. Data collection and data cleaning. So I would like to um, call on Ms. Yoma. Yoma, if you're on the call, I'm going to ask Ms. Yoma to walk us through what will be the challenges in data collection and data cleaning.
Hello again. I'm going to walk you guys through the challenges in data cleaning and data collection. Before any analysis happens, before any dashboard is built, before any insight is generated, there's a whole world of difficulty sitting between the raw health data and anything useful. And that's the word I'm going to walk you through. Imagine this scenario. You're trying to bake a cake, your flour is wet, some of your eggs are missing, your measuring cups are all in different units, and the recipe is written in a language you do not understand. That's what it means when you're working with a raw health data set. We have about six challenges, and I'll walk you through all. The first one is a data silo. Now, you might want to ask, what is a data silo? A data silo is just a collection of a data set from a department. Now, in the health sector, we have different departments, right? Now we have a patient going to meet the radiologist, the pharmacist, the cardiologist, and oftentimes the patient's documents are in different formats. They are not coming together, which is not supposed to be so. I know in other industries, good and fine, the data silos can be good, but when you're working with people's health, the data should be combined. And we saw this in 2020 where we had slow data comparison, slow data sharing for the healthcare system. We also have inconsistent data entry. This is very popular to us as analysts because you might want to write in different formats, but when we are trying to clean, it's literally showing a different thing. And if we're working with numbers, for example, um, a hospital can write a hypertension as normal hypertension, while another can write high blood pressure. And then one uses another code. Mind you, probably they might be using three different applications. One can be using Google Sheet, another can be using Excel, another can be using the oldest one so far called SPSS. All this can actually lead to inconsistent data entry. We also have privacy and compliance. Now, the health sector is among the most sensitive information that actually exists because it's our data set that are there. In the United States, we have the HIPAA, which sets strict rules when we are sharing data. In Europe, we also have GDPR, which covers the health data with additional protection. In Nigeria, we have HMOH, which also protects the Nigerian health sectors. But as data analysts, it creates a real operational challenge. You may have to ask for permission to use the data, when to use the data, and how long to use the data. You can see how it is when we are trying to ask for permission, trying to clean up. And sometimes they will always ask us to make it anonymous so that the patient's details will not be out to the public. We also have unstructured data. This one particularly can be like um, a doctor written note, a radiologist written notes. All these things are written naturally, but then when it comes to imputing them into the system, it can be another challenge. And globally, it's estimated that 80% of the healthcare is unstructured. Their data set is unstructured. And this causes a big challenge to us as data analysts. We also have human entry errors. I'm going to pause here because this human entry error, it's not, I'm not going to say it's our fault because normally it's not our fault. The WHO recommended 1 to 1,000 patients for doctors, but most parts of the country are still doing 1 to 5,000 patients. So now these health workers are being overstretched, they're being overworked. And at the end of the day, they'll still be the one to like type in the patient's data onto the system. Sometimes they may make issues writing the person's name wrongly, giving wrong age. And imagine if they are given a wrong age. As data analysts, we cannot assume. Assumption right here is a no-go. So we can't assume that, oh, because this person is having hypertension, we'll say, oh, the person is 50 years old. Well, you know that some people at age 27, age 24, they can still suffer from hypertension. Now, the last one is lack of standardization. This is another big challenge in data collection and cleaning. Now, take for example, in the US market, they use Epic Scanner, Meditech, and Allscript. And in other developing markets, they use Open source platform like OpenMRS and DHIS2. Now, we are taking data from two different systems, and it might require a lot of process, especially what we call the ETL process, that is the extract, the transform, and the load, which can actually take like weeks to clean up. Now, finally, these six challenges I have mentioned so far, they are hard, yes, but also they require patience and knowledge, and they are also solvable. Thank you.
Thank you so much, ma'am. Thank you so much, ma'am. And we're just going to move on to the next thing, and I'm going to bring in Miss Havila right away to be able to walk us through um, um, the role of data analyst in health. So we've heard about what a data um, what data analytics can do, but now I want to know the role of a data analyst in health. So thank you so much, Ms. Havila, over to you.
Thank you once again, Mr. Stewart. Thank you, everyone. Okay, so the role of data analyst in the healthcare industry, basically, right? We are the translators, we are the interpreters, we are the, for lack of better word, I would say we are the Google Translate, right? So we translate um, the vocabulary spoken between the tech infrastructure and the medical professionals. So we are that bridge that connects these two bodies together. So we connect the tech individuals with the medical professionals, right? And we're basically the set of people that bridge raw data to make life changing decisions, because data analysis is more than just collecting data. When you collect data, what do you use the data to do, right? So data analytics help you to transform data into insights, actionable insights that can actually help that industry. And as data analysts, we are responsible for not just building dashboards. We don't just build dashboards. So we collect and clean the data, right? So we're gathering data from EHRs, we're gathering data from labs. By the way, EHRs are the emergency health records. They're basically health records. So we gather data from the health records, we gather data from labs, we gather data from um, health centers, right? So when we collect those data, we clean the data. And there are different tools. I mean, we use to clean data. We have the Excel, we have the SRBI. Now, after cleaning and after collecting and cleaning, we then analyze it. So we analyze by spotting trends. We analyze by spotting insights. So we can try to identify diseases, rising diseases. We can help to identify effective treatments, right? In excuse me, in patients, right? So what treatment works best for what illness? We analyze those trends. So it's more than just figuring out that artemether works. There are different types of artemeters out there. So what actually works for what kind of patient, right? And after that, remember I started with we don't just build dashboards. So but after these two important steps, which is collecting and cleaning, and then analyzing those trends, we then proceed to build dashboards. Now, dashboards are the framework of the data being collected. So, dashboards hold or interpret the data and the analysis you have done, right? So, we turn complex data into visuals, powerful visuals, either using Power BI, Tableau, or Excel, right? And something our mentor always says, we should choose insights over aesthetics. So, as a data analyst, we're not looking out to see if the dashboard is fine or the color combination is T and the rest. We're actually looking out to tell, does this dashboard tell me? Does it discover? Does it show patterns? Does it show trends? Right? And after that, we support research. So after building these dashboards, we try to also manage clinical trial data. So there are clinical phases, and there are data that comes out of those phases. So when we manage the data, we use those findings and discover if they're actually statistically sound to what is already known in the industry. Okay, and then we monitor KPIs. These are metrics. These are our key performance indexes, right? So KPIs could be patient counts. KPIs could be um, billing rates. So we monitor these KPIs to actually show which indicators are actually working perfectly well in that industry, in the hospital, in the healthcare industry. We use this to track patient times. We use it to track bed occupancy. Are we running out of beds? Do we have enough beds left in the hospital? We use it to also track error rates in the industry, right? And we also detect fraud. Now, data analysts help to detect fraud by using billing patterns. So we flag billing patterns that are irregular, and of course we escalate. But through analysis of data which is in the healthcare industry, we use it to flag unusual activity, right? Maybe claims that were filed when the clinic was closed. I mean, how can you file a claim when the hospital isn't receptive of patients? So this helps us to detect fraud, right? Also, data analysts rather, help drive clinical informed decisions. A data analyst helps to analyze the trends that we've discovered, escalate to the clients, the medical directors, and the rest to highlight data-driven facts, right? It helps the hospital to actually make informed decisions. Another thing data analysts do, they standardize data, right? So they help during the collecting of unstructured data. That's actually in collecting and cleaning data. We standardize those data. We structure them out. This is meant to be for this. Maybe the ages rather of patients are meant to be under the ages column, that way, that way, that way. So we don't mix things up, right? We could see data error during data transfer. Blood sugar column is maybe probably in the blood pressure column. So we help to like structure and put a sense of structuring in the data collected. Over to you, Mr. Stewart.
Thank you so much. Thank you. Um, I mean, the things you just shared right now are very, very powerful. And let me just go straight to uh, Isaac now. So, well, I would like the two of you to, well, let me start with Isaac. What's the future of data analytics in health? Just like what you guys have already outlined in your slide that I'm sharing. What is the future of data analytics in health?
All right. Thank you so much for having me again. So, as we have already established, data analysis. Data analysis is not only a behind the scene uh, sector or tech skill. It's a skill. A skill that's actively participating in the healthcare sector, actively participating to transform the healthcare sector. So, what is the future of data analytics in health? So, the first thing there, number one, is that the future of data analytics in health, the data analytics field, we are trying um, to make use of. We are in a generation of AI and artificial intelligence and machine learning. So the data analytics now in health sector, we are trying to integrate AI and machine learning in the health sector, which will help to improve the health sector greatly. And the way the AI trends are going, it's with the help of AI now, you can easily come up with um, what's it called now? You can easily come up with with predictions on how to heal um, diseases that would have been very very deadly with the help of AI. Those diseases can be prevented. So yes, AI
So
and
sorry,
and
sorry,
machine learning.
sorry.
Okay.
Let me cut you a little bit there. So I totally agree with the concept that AI is going to play an amazing role in every sector, actually, not just health. It's going to be, and I love the fact that you mentioned that it's going to be very vital in prediction of diseases and, of course, even control. And AI is going to go as far as being able to help in developing new medicine and all of that. But let me jump straight to Ms. Havila. Please, ma'am, can you walk us through again the future of data analytics in health? Can you continue from where Mr. Isaac stopped and walk us through?
Okay, sir. Thank you once again. I actually saw a very interesting comment in the Facebook session, or Facebook Live rather. Someone said um, he was looking for his file or something like that. I forget now, but it has to do with hospitals still dealing with paper, hospitals still dealing with folders, right? So if there's an infrastructure whereby this data can be stored um, in a database of some sort, right? It's going to be actually easy for the data to be analyzed because we as data analysts, we don't work with just manual entry. I mean, we've come a long way. Tech in Nigeria as a whole has come a long way. So manual entry should be somewhat discarded, right? So if there's an infrastructure whereby exactly, however, I wish some hospitals can integrate this, something as basic as keeping records with digital technology is still very hard for hospitals, right? And if this data is readily accessible to data analysts, it helps. It helps because it helps in interoperability. So um, a future whereby a single patient, right, allows the doctor in Lagos to instantly pull up consent approved medical history from a clinic in Abuja. That's actually one of the futures of data analysis in the healthcare industry. Interoperable systems. So we're not dealing with the patient having to carry a lot of folders, a lot of flyers, and the rest. Right? We can just the patient can actually just move, and the medical records move on to go with the patient. That's talking about systems that are interconnected. That's one of the futures, or that's one of the points of the future of data analytics in the healthcare industry. We also have predictive and proactive care, right? So we are moving past um, passive treatment plans. We're more proactive, we're more predictive. So we're moving treating sicknesses to actually predicting those sicknesses. So analysts and maybe AI would also use aggregated data. So data stored up from, I mean, past time immemorial to actually flag patients like, look, you're actually heading towards something you should not. So if, for instance, at a consecutive amount of time, for instance, the blood sugar of a patient has been low, has been high rather, the patient has steady high blood sugar. It's predicting one thing, diabetes. So data analysis help us, or data analysts rather, help us to actually look at the past data and predict what could probably happen if that person still continues with the lifestyle he or she is currently in. Okay, and then another point I'd like to make is health tech innovation, right? Localized health tech innovation, APIs, which are application programming interface, to actually make it easy to access this data because we cannot just work with data if it's not accessible, if it is not readily available. So if this data is accessible and there's an infrastructure to actually hold that data, startups can build health apps, we can build health tech startups, we can build healthcare assets that is rapidly expanding across the continent, right? And this is actually how data analytics in the healthcare industry moves forward, which is actually one of the things my team and I in HealthStack are actually building. So we are building a way whereby there are interoperable systems that come together, meaning as the patient moves, medical records move with the patient. Thank you, Mr. Stewart. Over to you, sir.
All right. Yeah. Please, Miss Yoma, I don't know if you would like to. I don't know if you would like to. If there's anything you would like to share with us on that as well, Miss Yoma, please go ahead.
Okay. Um, I would like to talk about personalized medicine. Now, in personalized medicine, if you recall, we've not heard about DNA since the 90s, right? But now we're hearing about DNA. We're hearing about, oh, there's something in South Korea. There was a movie I saw in South Korea. You can actually check before your child is born. You can actually check if the child is going to have a psychological disorder. Back then it wasn't so, but now we have what we call this personalized medicine, with your data set, with everything, your lifestyle. I think dietitians also work with this. Your life, sometimes they said your lifestyle, the way you live your life can actually affect your meal or something like that. So this personalized medicine changes everything. I'll just touch a bit on the real time monitoring. This wristwatch we're wearing, this smartwatch, is never for fancy. I've always wanted to have one because I know I need to track everything that I'm doing. It's not for fancy. If you've seen it in people's wrists, know that it's not for fancy. Rather, it's to track their step, their water intake, their heartbeat, their pulse, everything. This helps to actually, it's for the doctors to actually track their patients as well, their patients' movement and every other thing. I think that's basically all. Thank you, Mr. Stewart.
All right. So as we begin to wrap up now, I would like to um, ask Mr. Isaac, what will be your final words for those playing in the health sector as it concerns data analytics? Go ahead, sir.
All right. I think there has been a lot of information disseminated in this webinar today. So my final word would be hospitals should try to integrate to ensure that they have data analysts um, working in each hospitals. People, data analysts that can take this information that are getting from hospitals, from patients in that hospital, organize them very well, and then for them to use it and predict the future. So hospitals should be able to make use of this big industry, this data analytics industry. They should employ more data analysts into the healthcare sector, for them to analyze data, in order for them also to predict the future of medicine in Nigeria and also in the world. Thank you.
Miss Yoma, over to you, ma'am.
Okay, to add to what Mr. Isaac said, I would like to say that the hospital should not actually give the work of a data analyst to a health worker, because I have seen it happen. The nurse will be the one to impute the data, the nurse will still be the one to go check on the patient. Like he said, the hospital should get more analysts for them and let the health workers just focus on their work itself. Thank you.
And yes, Miss Havila.
Okay, thank you, Mr. Stewart. I'll just end by saying that, like I said, we've come a long way in the healthcare industry with paper trails, looking for folders. I feel like with the way tech has advanced, right? We are more than that. We are really more than that. So I feel or I think hospitals should implement ways to actually digitize this data so that it's easier for them, so that analytics can easily be done, and so it's more accessible. Because I mean, folders, papers, it doesn't really help. It doesn't really help in actually structuring the data, analyzing the data, digitizing the data. So um, I feel healthcare professionals should actually look into how tech can help the work easier and faster. Um, Health Stack is all about that. Health Stack provides an infrastructure whereby we're eliminating paper trails, we're eliminating flyers and folders. We're building an infrastructure whereby this data can easily be accessed with consent from one hospital to another. So if a patient moves to and fro, past records can easily be drawn up with consent, and then treatment plans can be um, moved from there. Thank you, sir.
All right. Thank you, ladies and gentlemen. And I'll appreciate all our speakers for tonight. You guys have done